You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
On today's Weight Loss and Wellness Wednesday show, I'm really looking forward to sharing with you the 7 signs that your fat-burning hormones may be running low. And this is a real serious thing. This isn't even just when you get into your 40s, 50s, 60s, 70s. This is something that can happen. Honestly, I've seen it happen to teenagers and even a little bit preteen now. So we know that these specific symptoms can happen anytime in your life when the setting is right, when the environment is right, when your lifestyle has allowed this to express itself. And there are many different reasons why, but it's just vitally important that if you're struggling right now to lose weight, or you feel like the weight's starting to gain a little bit easier, you're not able to lose it as well, you're feeling a little puffy, those are some of the things we're going to be talking about today. Those are the initial signs that something's not quite right. Your body has lost its equilibrium, and right now it's struggling to get back in balance. So there really are 7 specific signs. I see them all the time in my functional medicine practice, but also I've been looking at them really for the past 2 decades plus in any body transformation client that I've worked with. I know which people are going to be able to lose body fat the fastest and who are going to be able to tone up, as they say, their muscles the fastest, and those that are going to struggle a little bit more. And the truth is that if your fat-burning hormones are still on overdrive, you're going to be able to lose the weight much faster. I know that makes sense, but at the flip side, if your fat-burning hormones are a little bit lower, those are the people they say, well, why is it that those people, this person, my friends, whoever it might be, and you know you have those friends, they seem to burn the body fat off easier. So what I want to talk about is, what are these hormones that we're talking about in the first place? You know, what are they? What are your fat-burning hormones in the first place? Well, simply put, when we look at all the hormones in your body, that's what equals your metabolism, essentially. We're looking at testosterone, we're looking at DHEA, we're looking at progesterone, we're looking at the progesterone to estrogen balance, and then we're looking at the stress hormones such as cortisol, norepinephrine, and that's what we call the stress-based hormones. So we want to look at those specifically. And then on top of that, we want to know, well, what's vitamin D look like? What's insulin look like? What's your blood sugar look like? And if you're not getting those lab tested, and I'll share with you how to do that if you choose to, but if you're not getting them lab tested, you don't know, but there are signs. There are signs that there's an imbalance with those specific hormones. And a lot of times it's just over time, your body has gotten stressed. It has gotten worn down from viruses, from toxins, from heavy metals, from life in general. And when that happens and you haven't brought it back into balance, you start to lose the more metabolic hormones in your body. They start to go lower. You know, they're always there, but they're at a lesser degree. They're out of balance. And so what I want to do is I want to share those signs with you right now, because I'm telling you, if you have 3 or more of these signs, it's really time to get started. Honestly, you can't wait another 6 months, another year to begin to get these back into balance, because it takes that much longer the longer you let it go. Okay? Again, there's hope for everyone, but just don't let it go too long. That's my advice. It's easier to correct it now. So the first sign that your fat-burning hormones might be kind of low. Now, this first one is going to be obvious, right? It's going to be obvious. But you have weight gain, and not just weight gain, dramatic weight gain. Meaning, like, if you have a cheat meal, or you go out, or you're really not watching your diet, and you gain 3 to 5 pounds, literally in a cheat meal, you say, whoa, you know, what went on here? Well, yes, that's a consequence of inflammation, but that's also a consequence of an imbalanced body. And that imbalanced body, well, that's not going to allow for the flourishing of a good progesterone to estrogen ratio, good insulin, good thyroid. We haven't even talked about thyroid yet. And of course, the adrenal glands. So dramatic weight gain, watch out for that one. That's a key. A lot of people they'll go out, they'll have a couple of drinks, they might have a slice of pizza or two, and they gain a pound or so. Not 3 pounds, not 4 pounds. That's the sign. The sign is that your body really can't stay in balance. The smallest thing, one cheat meal really pushes it over the edge. So watch for that. All right. Number 2, second sign is puffiness or bloating. So when you're looking at your body and even just your face, it starts to look a little swollen, a little puffy. Even maybe just the eyes. Well, that's a sign too that the lymphatic system is becoming congested. Again, all of these things having to do overall with your fat burning hormones. You might say, well, how's your lymphatic system possibly, related to your hormones? Well, it's because, again, when the body has shifted too much towards the stress-based hormones, our digestive system, our parasympathetic nervous system, our lymphatic system, they get a little bit more sluggish. And the reason is that your body is like this giant teeter-totter that's just going back and forth, and it's trying to maintain equilibrium. Well, when it's pushed down to one side for too long, too hard, you miss out on a lot of more of those healing-based effects. And we know that. This is very well researched. So puffiness, bloating, watch out for that. Bloating is well in the gut. And the reason is, when you are stressed, when you're producing more cortisol, more stress hormones, you are not able to digest your food as well. Simply put, your blood is fueled more in your muscles, pulled more towards your tissues, getting ready for the fight or flight rather than in your digestive system. They've known this, again, 6,000 plus years in Ayurvedic medicine as well. All right, sign number 3, a loss of muscle. Really, a loss of muscle. So not only are you starting to gain weight, not only are you getting a little bit more puffy, might get a little bit more cellulite, but you're losing muscle and you're losing muscle tone. This is not a good thing. Why? Your body needs the DHEA. It needs the testosterone. It needs the growth hormone. Those are all, again, parasympathetic based. Those are all healing based. Those are all anabolic. And when your body's catabolic, when it's breaking down, it's losing muscle tissue. It's losing bone, but it's gaining body fat. It's like this double whammy that nobody wants, but that's what happens within the body. And you might say, well, it happens because you age. That's only partially true. Just this small little sliver of truth to that. The truth is it's just accumulating. And that's the problem with age. It accumulates over time because we've let it go. That's the real problem. I work with 60 plus year olds right now, and I've worked with 80-year-olds as well that are in fantastic shape, like literally fantastic shape. And they stay that way because they've honestly balanced these hormones. That's the big secret. That's the reason. It's internal. It's not always just what you eat because, of course, they're going out there enjoying the same cheat foods with their friends as well. So watch for that. A loss of muscle, really important. Number 4, and I put these in my order of how I see the cascade effect happen within the body. All right, for the majority of people, low sex drive, a decrease in libido. All right, this is really important because your fat burning hormones are the same ones that increase libido. So if testosterone's high, DHEA is high, thyroid's functioning normally, cortisol isn't too high, your libido is going to be increased. There's no doubt about it. You're going to be producing adequate amounts of dopamine, norepinephrine, serotonin. Everything's balanced. Everything's good. At that point, you have not overactive, not anxiety-based libido, not low libido, not low sex drive, but normal. And that is a great sign of a well-functioning metabolism. Now, you have low sex drive. Your fat-burning hormones, without a doubt, are going to be low as well. Your thyroid could be well, and your adrenal glands, they're stressed. And those are protective mechanisms, meaning that I don't want to get too deep into this right now because that's not what this show is all about. But really, when your libido is decreased, really important sign to start looking at the adrenals, start looking at the thyroid. Adrenals first, thyroid second. Real important to look at. Okay. Everyone wants to look at testosterone. I understand that. Testosterone is a consequence, either way, of healthy adrenals and healthy thyroid. Either way. Okay. Doesn't come first. It comes second or third. Really important. We'll talk about that in the future as well. All right, number 5. Number 5 is fatigue, whole body fatigue, and brain fog. So brain fatigue as well. Cloudy thinking, forgetting things. I would also say poor recovery between workouts. If you're exercising, you're getting more inflamed, poor recovery. Fatigue in general. Really important. That is a sign that the hormones, that your body's ability to even regulate inflammation has started to decrease. Real important tip. Truly, it's hard to have chronic fatigue, fibromyalgia, a lot of these brain fog-based issues, and not have a decrease in our fat-burning hormones. Real important right there. All right, number 6, sudden hair loss. So hair loss or just a gradual thinning, as well as even hair loss on the body. Now, this is real important to look at as well, because we know as we start to get thinning hair for women as well as men, and a thinning of the eyebrows, especially that last third of the eyebrow, as well as losing hair, especially on the lower leg in men, really, really important signs right now that we're either converting testosterone to DHT, dihydrotestosterone, which no guy wants. Women don't want it either. That leads to prostate-based issues. It leads to hair loss. It leads to hair gain on the back and other areas that, again, both men and women don't want. And real important as well, it can be a real sign, a true sign that you have a lowered or hypothyroid. Okay, real important to look at. And the reason is this. These are happening at a subclinical level, meaning that we know that this is going on. We know that this correlates with low thyroid, low testosterone in both men and women. I really want you to take note of that. And that's because it's an outward sign of an inward problem. All right, so that is a symptom of something going on deeper within the body, and rubbing creams on your head or anything like that, they're not going to work. Sure, they might work in the short term using some type of cream. I don't want to name the creams right now, but not in the long term. That is not a long-term fix, and the reason is you're not doing anything internally. So if you want, do it externally, but don't expect that to be the long-term fix. All right, number 7, we're at our 7th sign already. The 7th sign that you might have low fat-burning hormones is irritability, depression, feelings of overwhelm, and a decrease in self-confidence. They're all basically one and the same. Irritability, depression, overwhelm, decrease in self-confidence. Why? When your body wants to go into this reclusive mode, it wants to hide away in a cave. These are all signs of an extremely stressed body. What happens when your body is stressed? It wants to pull away. It starts to get a decrease in adrenal-based function. It then starts to lower thyroid. Hypothyroidism is an effect of high stress. Yes, it can be an effect of heavy metals, gut-based dysfunction, no doubt about it, which we could also attribute to stress. But what happens is we start to lower the thyroid because our thyroid also helps to regulate metabolism. When we are stressed, it's a protective mechanism by the body. The body never messes up. It never messes up. This is a sign now that the body is trying to lower your threshold for survival, meaning that, okay, we want you to eat less, or we're lowering your caloric demand because we know you're stressed. This could be a time of famine. Could be a time of disease, could be a time of war, could be anything going on. So what we're going to do is we're going to try to lower your metabolism to keep you alive longer, just in case you don't have access to water, food, shelter, any of these things. It's going to help with that. Again, if you know how the body works, if you can look at all the systems of the body, instead of being a specialist, if you can be more of a generalist, if you can be someone that looks at all of the systems of the body and how they interrelate, you can understand how all of these things work. But the great thing is this. As a natural health practitioner, as a naturopathic doctor, what I can do, what I've learned is to say, okay, these are the different symptoms going on the outside, but really, we have to go inward. We have to figure out, why is the body so-called malfunctioning? Why is the metabolism lower? Why aren't we burning as much fat? Well, when we start to look at the hormones inside the body and we look at the mechanisms that affect the hormones, we can now understand why anyone isn't at their ideal weight. Not everyone's going to be stick thin. And everyone shouldn't be stick thin. That's not the goal. The goal is to get you at your ideal body weight, at your healthy weight. Again, if you're 6 feet, the goal of you being 120 pounds, man or woman, is probably not a good idea. I mean, honestly, that's probably not a good idea. And that's not healthy. And so if that's a goal of yours, we also have to look at, is that healthy? So we just want to match up with healthy. Health is also your overall BMI. I know it's not for everyone, but it's part of it. It's looking at your waist to hip ratio. It's looking at your overall function of the body, but it's also looking at these 7 signs. If you've gained weight rapidly, if you have puffiness or bloating, if you have a loss of muscle or muscle tone, if you have low sex drive or libido, you're feeling fatigued in mind or body, if you have some type of hair loss, sudden hair loss or not, thinning of the hair, the eyebrows, hair on your body, or you're feeling irritable, depressed, overwhelmed, lower self-confidence, these are signs that something is going wrong within the body. And the hormones help to regulate these things. There's a few things you can do right now. Let's just talk about those real briefly. One, and I always recommend this. Here's my thing. If you've been suffering long enough, it's time to put the suffering to an end. And by that, I mean test. Stop guessing what's going on and test. At some point in your life, it's probably a good idea to test. You can find a functional medicine doctor you can trust in your location, or you can simply go to stevencabral.com/store. Choose a functional medicine lab test that works for you. Literally, we mail it to your home. So in this case, the best one to choose, the comprehensive weight loss test. Why? It's a weight loss test, but it's really just, this is what it is. It has nothing to do with weight loss, because weight gain is a symptom. It's honestly a symptom. There's nothing wrong with you to gain weight. What's wrong is internally. So what does this weight loss test do? Well, it looks at your adrenals. It looks at your thyroid. It looks at your blood sugar through insulin. It's going to look at vitamin D. I mentioned that adrenals, but it looks like the cortisol throughout the day. It tests your DHEA, tests your testosterone, your estrogen-progesterone ratio, which is so important for women. So important that we never even talk about that either. And here's the deal. It gives you all of those things through a simple saliva-based test and a blood drop test. Literally, a little poke of the finger like a diabetic would do to get a little bit of blood sugar. You put the drops on a card. Anyone can do it anywhere, and you just mail it back to the lab. It's that easy. Literally, you mail it back to the lab in a prepaid, I believe it's a UPS mailer, prepaid UPS. You drop it in the mail the next day. It takes 1 day to do this test. It's really simple, a couple minutes out of your day. And then you get the results back in about 3 to 4 weeks. And I review that plan for you. And you get a 30-minute call with one of our health coaches to give you my recommendations. It's really simple, really straightforward. Now, you don't have to do this lab with us. So all you have to do is you can go to the website. You can check it out. You can see what it is. And again, like people listening to this in Australia and in Iceland and in Argentina. So here's the deal. We can't work with people internationally yet for this specific lab. We might be able to. I don't know. We'll have to check with the lab on that. We'll get back to you on that. But here's the deal. What I'm trying to do is give you the knowledge that these tests are even out there, to start to take back control of your own body and your own health. That's what this is about. Like, did you know that there's actually a test where you can look at your adrenals? You can look at your thyroid function beyond TSH. TSH is nothing. It means nothing. It's thyroid stimulating hormone. How hard is your body working right now from a hypothalamus pituitary thyroid axis to push your thyroid? Like, that's literally it. Well, we want to know what your T4 is, your T3. We want to look at your TPO. So that's what this test looks for. Okay. Look at your hormones, your testosterone, from a free testosterone, free DHEA, from an estrogen and progesterone standpoint. Again, this is so important. You really want to look at these markers to take back control of your health. Now, if you're not able to run a lab right now, I understand. What you want to do besides that, if you can't run the lab, which is the most important thing you could do, is you start to reduce stress. You begin to do some strength training 2 to 3 days per week. You decrease your inflammatory foods. You lower the glycemic index over all of the foods right now so that you can better stabilize blood sugar. Now, you can simply learn how to do all of these things, because they're all individual shows, by going back to stevencabral.com/podcasts. On those shows, you will find one on regulating blood sugar. You'll find one on decreasing stress. You'll find all of these shows. And that's why I can't recommend enough. If you're really serious about taking back control of your mind, your body, your health, and then being able to share your own success with your family and friends and coworkers in your community, take care of yourself first. Listen to the back episodes of the Cabral Concept. Run tests if you can and when you can, something like the weight loss test. It's not about you doing it through our company. It's about you getting the knowledge, getting the results that you deserve. This is how I got better, and it's simply why I want to now be able to pay it forward and share it with you. I do hope that you tune into today's podcast notes. So you simply go to stevencabral.com/551. I'm going to link up that one specific lab in the show notes, but I'll also link up other ones such as the adrenal and thyroid, because maybe you just want to look at those individually. So why don't I do that for today? I'm going to link those up. And then what we'll do is we'll link up the stevencabral.com/podcast, just so you can start to tune back into previous shows. Maybe you're not ready yet. I don't know where you are on your healing journey. Some people are ready to get started today. Some people, they want to just digest it a little bit more. They want to get a little bit more information. That's okay. No matter where you are right now on your healing journey, we are here to help. Let my team know, let myself know how we can help you. Again, our job is to make sure that we empower you with the knowledge that you need to get well and then be able to pay that forward to other people in your life. That's how we make the change. Thank you everyone for tuning in to another Cabral Concept. I appreciate each and every one of your listens, and I can't wait to talk with you tomorrow on another Cabral Concept. Before you go, I wanted to share a personal story with you. The real reason I began to get well finally is because I figured out what was wrong with me. And that might seem pretty obvious, but I went from doctor to doctor for over 2 years before discovering at-home functional medicine lab testing. These are the labs that enabled me to finally figure out what was wrong with my hormones, blood sugar, electrolytes, and gut health. And once I knew what was wrong, I could then follow a proven plan in order to rebalance my body from the inside out. This is why I believe so strongly in functional medicine lab testing, and why I've made it my mission to share these labs with the world. Now at equa.life, you can order an at-home lab test or lab bundle for you and your family and be able to complete it within the week. Plus, the EquaLife difference is that you're not left to try to read and figure out these labs on your own. We explain what your lab numbers mean, what they mean in the much bigger picture, and then how to go about rebalancing your body in order to heal. To see our full selection of lab tests, or to set up a free lab selection call to find out what labs may be best for you, simply head on over to equa.life/labs. And do remember, we ship these all over the world. To find out more and to set up your free lab selection call, simply head on over to equa.life/labs. That's EQUI.LIFE/labs.